we might well become core if others join us here. But the business is such that I think proceeding informally is fine. What I suggest we do, we always have a good mix of council officers and other partners on this meeting. And I suggest that when people speak, they just introduce themselves in case there's any new people who don't know each other. And have we had any apologies for absence, Naz?
We've had apologies from David Archibald and Councillor Mike Alcázar.
Thank you. Do we have any items of urgent business?
No items received.
Thank you. And do we have any declarations of interest from anyone? No? Okay. Thank you. Questions, reputations or petitions?
None.
We'll have to do something about that since we want to encourage some people to come and speak to us. Moving straight on to the minutes of the last meeting. Do we have any comments from anyone on the minutes? I'll just pause for a second if anyone has anything they want to highlight or draw out. No? Okay, well, let's move then straight to item 8 on the agenda, which is Family Hubs and the Best Start for Life briefing. And I think Jackie DeFalco is going to introduce this item. Over to you, Jackie.
Thank you, Chair. I'll just get my presentation up. So, members, you would have had a report circulated in advance that has more detail, and then I've just got a summary presentation that I thought would be helpful to take us through. I'm just going to share that.
It's okay.
And also just to note that it is slightly different to the version that was circulated in your packs, just because we're updating this programme as we go along. So, is that sharing on your screen?
Yes.
Yeah. Great, thank you. And I'm in a very busy office, so apologies if you can hear some background noise. So thank you for inviting me to come in and give you an update on this programme. I'm really delighted to share this information about what this programme will mean for families in Haringey. So it's just a high level summary, but more details in the paper, and happy to answer any questions at the end. So in terms of the programme itself, Start for Life and Family Hubs is a DFE-led funded programme, and we're one of 75 local authorities that have been chosen to be on the programme. And that's basically, that's essentially based on our population demographics and our indices of deprivation. We've been working with the DFE for many months prior to us knowing that we were going to be one of the 75 local authorities to influence this programme. And the programme essentially has a number of key aims. It's absolutely predicated on the Support and Families agenda, the Healthy Child programme, and it has a really close interface with the integrated care, health and wellbeing strategy, and the proposed SEND reforms that are currently out to consultation. In terms of the key areas of focus, is absolutely around early intervention. So prevention of escalation, making sure that we are providing evidence-based interventions that will both improve outcomes and reduce inequalities. There's a key focus on particular areas that are linked to the funding streams, which I'll come on to, but essentially the key areas are a focus on perinatal mental health and breastfeeding and parenting support across the 0 to 19 agenda. Another key area is about making sure that there is accessible information, that we have a confident and competent multi-agency workforce, that we have robust data that informs our delivery model and changes over time, and that we have really robust evaluation, evidence and impact. Very big focus on multi-agency locality working and a development of a network of family hubs that are either physical, virtual or based on an outreach model. So it's expecting you to incorporate all three elements. And really that's about making sure that children and people aged 0 to 19 and their families can access services in the way that best suits them. We are currently, there is an expectation that you co-produce this model with your partners and families from your local areas, and that's something that we've started work on already. And fundamentally, they will be using, because we're one of 75 local authorities, this model and the learning from this model will be used to inform future policy direction. What you see in front of you now is the funding that Haringey will receive. So upon approval of our implementation plan, which is due by the end of December, but we have a different an initial stage to go through first, we will receive between 3.6 and 3.8 million pounds over 3 years, which is just fantastic. There is a category of spend. So on the screen, you will see the areas that we absolutely have to, what some of the requirements are that are linked to funding. But in terms of the breakdown of spend, there is some specifics. So in terms of program spend, so that whole setup, establishing those hub models, that network, that's just under 20%. Just under 5% is to be spent on capital. So that equates to £200,000, which gives you an idea of the scale of the work that we can do. So it's not necessarily around a lot of capital work. It is much more of a focus around accessible buildings, but much more about integration. 16% to be spent on parenting support. 9% on home learning, so making sure that we're taking services out to families' homes through that outreach model. The highest percentage is for perinatal mental health, so just under 32%. And then just under 17% for infant feeding support, and the remaining just under 4% for parent carer panels. So adopting a similar model like we have within the SEND system, where parents and carers have much more influence in directing this work going forward. So in terms of there's 3 key principles really to this work. It's about how we are accessible, how we are better connected, and how we are more relationship centered. So in terms of accessibility, it is a clear requirement that we have to have a universal single point of access, a really clear local family hub offer that is recognized and understood by families. In terms of being better connected, it's really building on the work that we are already doing in Haringey in terms of increasing that pace to have much more join up between professionals, that we are co-located, that we are integrated in terms of doing things like more joined up training, that we have a much more partnership and systemic response to this area of work, that we're sharing data, that we're being clear on having common outcomes and working towards those outcomes, and that we have robust governance. In terms of the services itself, we have to deliver a set of minimum expectations, which go into much more detail in the paper, and I've referenced the link for you to go into, but it's across a number of areas. And I'll talk about the services and scope on the next slide. But essentially, it's about having wraparound services, whole family work, not just focused on silo working or with a particular age range. While some of the funding has an age range attached to it, so some of it is focused on 0 to 1, the vast majority are focused on 0 to 19. The other key area that we're expected to focus on is making sure that we are improving our relationships with families. So not just within our own family hub network model, but extend that wider to across the system, across a range of partners. And we have also been invited to propose whether we will go further with some of the expectations. So every local authority that's been selected has to deliver the minimum expectations, but there are a number of areas where we can choose to go further, and that will be the difference between the 3.6 and the 3.8 million that I referenced earlier. So on the slide, you'll see these are the services that the core services that we are expected to offer through the family hub model. Some of these we have in place now. Some of them we do have a close relationship with, but they're not necessarily delivered through a family hub model. And we've been working with a key stakeholder group with representation from public health, Whittington, integrated care, CAMS, children's centres, early help and so forth, to really think about what would our core offer look like based on the principles that I've discussed and what the services are outlined on the screen. That's influenced our sign-up form that we are expected to submit early October. And we've also been really thought about the outcomes that families are expected to achieve as a result of a good family hub model. And you'll see those outlined in Appendix 1 of the report that was circulated. So in terms of where we are, we have drafted a sign-up form. So this has to be in by early October. And within that, we have to outline what we believe our offer will look like, what our core offer will look like. It's very high level. It's got a very strict word count. So on average, 300 to 500 word count. So it's a very high level document. If that's approved, that will then inform what our robust and much more comprehensive, detailed implementation plan will be. But essentially, we have to deliver at least 1 family hub by June 23. We're aiming to have 2 by the end of 23. And we also want to have 4 in total across Haringey. They don't have to be based on children's centres. They can be based on different buildings. So we are starting off with Triangle Children's Centre because we believe it's well placed to be that multi-agency family hub model that we're looking to develop. but that we may look at other buildings depending on where they are across the borough. So Rising Green Youth Hub as an example, may be something that we look to develop into a family hub, so it doesn't just have to be children's centres. In terms of the go further expectations, you can see outlined on the screen, these are the areas that we've covered within our sign up form. So being very clear around evidence-based interventions, expanding our infant feeding support offer across the borough. So we're extending it to think about, yes, we have an offer in the borough, but is it an offer that's bespoke to communities such as the Somali community? So really thinking about what will work best in Haringey for our communities. In terms of the sign-up form, that has to be signed off by our Director of Children's Services, our leader, the Chair of the Health and Wellbeing Board, and the Director of Public Health, alongside our Chief Executive. So we have circulated that document for comments and hoping to receive that by the end of September. In terms of our governance, we have thought, where would this be best placed? And it is predicated on a children's centre agenda, but extending that to 0 to 19. So we felt like the best place to position the oversight for this would be with the Startwell Board, which is chaired by the Director of Children's Services. So in terms of the implementation plan, it will progress to that board for robust governance and sign off before it is submitted formally to the DFE for approval. We have a number of reference groups that will provide scrutiny and challenge, so the Health and Wellbeing Board being one of those, but also our Early Years Strategic Partnership Group and our Early Help Strategic Partnership Board, both of which have 2 clear strategies that underpin and strengthen this work going forward. In terms of the operational and oversight of this programme, we do have a Family Hubs implementation group, so the group that's in grey, and that's chaired by the Head of Service for Early Help and Prevention, and they'll be working with operational stakeholders really in terms of being clear on, are we delivering against this plan, are the priorities the right ones, and making sure that they're highlighting any risks and mitigation, and as a result, bringing those risks and progress updates to the oversight group, which should be chaired by myself. And what we will be doing is making sure that the programme is delivering as per the expectations and making decisions about future delivery practice. So in terms of the next steps, we are ahead of the game. So we want to get our sign-up form in earlier than expected so that we can receive feedback. We've already met with our link with the DFE, who's reviewed some of our information and has been very pleased with the progress that we're making to date. We're developing and we want to establish our governance approach that's been outlined. So that is still some work to do around just making sure is that the right governance structure for us. And we want to develop a communication and engagement strategy so that we can be very clear about going out to our communities to influence what will be the implementation plan. Public health colleagues are supporting us with a refresh of the needs analysis to make sure that our implementation plan is informed on robust and up-to-date data. And we're in the process of developing what we think our projects and work streams will be for our implementation plan. So we won't be waiting to be given a structure to complete. We'll be getting on with doing that in the meantime. So this slide just highlights some of the milestones and where we are at with those. In terms of overall progress, as I said, we're well on track to be completing the timescales that's expected of us. And making sure that we are taking them through the right governance processes for sign-off. These are indicative timescales. So in terms of our family hubs, we're talking about one being open in June, July 23, one by the end of the year, and then the 3rd and 4th one to be confirmed at a later stage, because we want to use the learning from those hubs to inform successful hub models going forward. I just thought it'd be helpful for the board to be aware of who the core individuals are involved in this area of work. So I'm involved overall as the project sponsor, so we'll have the overall responsibility for delivering this programme. Simone Common, who's the Head of Service for Early Health and Prevention and chairs that implementation group, is our operational lead. And we've been really fortunate to recruit Gary King as our programme lead, our programme manager for this programme going forward, to make sure that it delivers as per the expectations, but not compromising outcomes for families in Haringey.
Thanks.
And just any questions?
Thanks, Jackie. That's excellent. Really useful introduction. Now, can I just check? We're now forward.
Definitely.
So just formally, we're now moving forward. Now that we have some people join us in the room, and we're now forward. So no longer moving forward informally. Now, normally I take questions from the room, but I've got lots of questions, and I now haven't had a chance to catch up separately with Jackie and then I'll take some questions from all of you if that's okay. On this occasion, I just had a few, some more observations and some more questions. Firstly, I wondered about our efforts to engage the most broadest range of parents in this project, not just in the delivery of service, but in the co-production. And we know that we always have this, those that are hard to reach, who I like to think just because we haven't reached them in the right way, rather than that they're in themselves hard to reach. So again, just wondering how we're going to do that, make sure we've engaged a full range of people from different backgrounds and different lived experiences in the co-production. And then I thought the structure of your presentation was really useful, and I liked that structure chart where you showed the governance. I think that's really important. But what I felt might be missing is the role of families in that oversight structure, and how they sit there, and how those co-producers see themselves flowing through. So that was a question / comment. And I always say this, so I wouldn't not say it again, which is how we, within the programme, we're building in developing those people who are co-producers, how we're investing in them so that they can do their best. And we know that there's been comments made to this panel, so it's to this committee before, about how people feel who don't make it onto a co-production group, and how we make those choices about the people we engage with. So again, something about that transparency. I wondered how we were overlaying inequality and inequity, particularly a focus on perinatal and some of the other conversations we've had this committee before. So that was just on my mind. And just to be clear on the political oversight, that's through the Start Well board to the cabinet member, and then the Health and Wellbeing board. Those are the, I think I've got that right, but you could clarify that for me. And then I suppose I had a question about what data we've used to think about the location of hubs. I can imagine it, but I think it might be useful to talk about that and understand how we've arrived at locations. And finally, a topic that's very important at the moment, we're discussing a lot in the council, certainly at cabinet we are, and in other parts, just about how we connect and join up the existing things that are taking place. So you've mentioned debt and welfare. I know we have quite a sophisticated and developed approach to substance misuse and alcohol use for families. So just interested in how we're using all that learning that's within those services and joining that up so that it feels connected for residents and connected with some of the other services that we might be providing. Sorry, that was quite a lot from me.
Mm-hmm. Thank you. So I hope I've captured them all correctly. Please let me know, Chair, if I've got any of these not quite correct. So in terms of how we are engaging a broad range of families, so we're actually very early at the stage of this journey. In terms of the sign-up form is the form that we need to get in. So we're developing a communications engagement plan, but first and foremost, we're going to make best use of the existing mechanisms that we've got. So making sure we've been going through our children's centres, our youth centres, our voluntary sector agencies, the Send Power Forum as an example. So we'll make use of those mechanisms, but absolutely welcome, any sort of direction you can give on communities that you think that we're not reaching, that we can make sure that we do that going forward. So in print, essentially our content engagement plan will set out a very clear process of how we seek to engage families, but I absolutely will make sure that we ensure that that's about reaching a broad range of families and making sure that we've got inclusive responses possible. In terms of our governance structure, yes, I completely accept that, and that's just an anomaly on my part, really. So we are expecting that we'll have parent care representation on the implementation group that will be chaired by the Head of Service for Early Help and Prevention. How that's to be decided is something that we need to talk through in the task and finish script that we've got up at the moment. It may be that we could go through our children's centre network where they have advisory boards that have parent care representation as a start, and build on that as we go on. I think you make a really good point about support for parent care engagement, making sure they've got the right support and tools to be able to feel like they can engage in this work effectively and meaningfully. We will adopt a similar approach that we've done with Send Power, in terms of it won't be in the same way in terms of the expectations. So we have a statutory expectation of the parent carer forum, but it will be very much based on the same principles. So looking at, do we need to commission an external agency to support parents and carers to engage in this meaningfully? Do we maybe need to use some of the funding to employ a parent carer to work alongside us with this and make sure that parents and the carers feel supported? It's something we'll definitely have to look at. In terms of inequality and equity, so we have a task and finish group at the moment that's made up of the services that I talked about earlier, and we very much felt that they were the services that represented our key stakeholders. But as we move into the next phase of the implementation plan and the implementation group, we just need to make sure we've got the right representation to ensure that they are advocating on behalf of those other agendas that you talked about, particularly in relation to the core services and linked to different agendas across the borough. So that's definitely something we'll have to make sure we've covered. We've had about 6 or 7 stakeholder meetings, and I think we've got the right representation, but it is definitely something that we need to go back and review as we progress to the next stage. The governance structure, yes, it will absolutely be the Startwell board that will be responsible for the oversight of this programme, reported to the Cabinet Member for Children, Schools and Families, but with a dotted line to the Health and Wellbeing board. So it may be that as a board that you feel you want to receive progress updates, on a regular basis, and we can make sure that we provide that, even if it's just for information only. The location, so the only location that we've committed to is Triangle Children's Centre at the moment, and that's really about the location, the size, the fact that it's already building on a good framework of having a lot of partners already working from that building, and it operates as a family hub model, although not in the formal sense. So that's the one that we've committed to, but the other areas we have just said to be agreed, because we really need to see what our needs analysis tells us in terms of where is the right location to have these buildings. But with the capital funding that we have, it will be making best use of the capital assets available to us, because £200,000 will only go so far in terms of making buildings more accessible, maybe more welcoming. So a children's centre, turning that reception area into something that's more welcoming for 0 to 19s, as an example. Did I cover all of your questions? Was there anything else I'd missed or hadn't responded to?
Last one on how we join up, because you mentioned things like debt and welfare, substance misuse, and we obviously have quite sophisticated services already around that within the council. So just how that's structured.
Yeah, so it's making sure that the implementation group that will be responsible for, let's say, the day-to-day operation of this work has that right representation. The group that Simone is currently chairing has evolved as a result of the early years strategic partnership, which was a result of our early years review and has informed the early years strategy. We now need to expand the membership of that group to make sure it covers all of those core services. So as an example, we don't have a housing rep at the moment, and that's going to be critical moving forward. So our next stage is to really firm up those governance structures and make sure we've got that right representation.
That sounds great. Thanks, Jackie. I just can't emphasise enough, and I think we've heard it plenty of times from the leader, also that issue of being able to engage families who don't have English as a first language, fully engage, and it does need depth and thought. But I think it's really, really important, because those are some of the voices that we don't always hear, but they have a great role, I'm sure, to play in helping improve what we do. So just emphasising that and that co-production, and I definitely would like to see a bit more of a clear how that co-production will really participate in the governance, or how it will move towards developing those families and their input, so that they then are really active partners in helping us manage and govern what we're doing going forward.
Oh, hi. I know this is a high-level document. If I could make an observation and a suggestion. First of all, my suggestion is, at the moment, we still have a primary care lead for children and young people in Haringey. As Dr. David Masters, I think it'd be really good if you had a little bit of input from primary care, because obviously in primary care we do a huge amount of paediatrics and interaction with parents and parenting. And the second is an observation, really, is that the care of children and parenting starts before the baby is actually born. And I'm really not sure at the moment what happens antenatally, so to speak, and postnatally, and whether that is joined up. I think it's a slight shame if we have these sort of dislocated services. Speaking personally, I think parenting's about the hardest job I've done, which I did with minimal training. So I'd like to see a bit of continuity here between before and after the baby is actually born.
Thanks, very good points. Jackie, did you want to come back on any of that?
Just all very good points, and I absolutely will make sure that David's involved in this going forward. I think that the point that you've made around making sure that we've got the joiner, we really need to make sure that our needs analysis informs this very clearly about what we already have in existence, what we need to build on, and what the gaps are. So really good points, thank you.
And I think it might have been at the last meeting or the one before, so forgive me. We had a good conversation about support to women who are going into labour, etc. And for me, it all connects really closely to that. And I can see Rachel's got a hand up, so I will bring Rachel in, and then I'll bring you, Rachel.
Oh, thanks, Councillor Desneves. I just had wanted to make that same point. And I think one connection that it would be good if we could make is in the outcomes that we're trying to achieve from this. We are now starting to dig into stillbirth rate in Haringey and why that was historically high. And we don't have the answers at the moment, but it is likely to be that interplay between socioeconomic factors and deprivation and early support through the antenatal and postnatal pathway. So I do think it would be really helpful if we just keep checking that what we're trying to achieve through this family hub is really supporting those kind of equity and equality findings that are there in the Start Well report. I think it would be really positive. And I expect that there are very good connections with North Middlesex, but there's a huge amount of work that goes on. I think North Mid has been particularly has been particularly proactive in making sure that they are providing continuity of care for women who are experiencing poor perinatal mental health or multiple deprivation factors. But I think it would be really good to, if we've not already got very strong links with that, the midwives who are involved in that, they have really good ideas about what could be strengthened, and particularly they've been really keen to kind of come out a bit more into the community, and they know where the gaps in service are, and we're already working with them on some of it, which would be nice to kind of link into this family hub model. So it's just that link with maternity departments and with the issues that have been highlighted for Haringey through that Start Well programme would be great to make.
Yeah, thank you, Rachel. I do believe we've got representatives from North Middlesex on the implementation group, but I will go back and check that after this meeting.
Jackie, would you mind taking your presentation down so we can see more faces? And Chair, just to say that I think Jeffrey's had his hand up, but we might not have been able to see because the presentation was in the way. Thanks, Jackie.
Thanks, Anne. That's really helpful. I've also got Zena waiting, but I'll take Jeffrey since he has been waiting, and I'm not sure how long now. So that's on the chair. Sorry, Jeffrey, and then I'll take Councillor Harrison.
Thank you, Chair. So I think I want to support, Chair, actually the point you were making earlier on around the families and the co-production, and picking a particular example around the triangle. So I think, like Jackie said, triangle really well suited for this because of the infrastructure there. There is, and like you said, Jack, I think this is early days, but if we can plan around, for example, there is a management advisory board there that has got local parents there. There's got, Orthodox Jewish groups, women's groups in there, part of that. We actually help to kind of co-chair it and bring all these people together, and then the agency there as well. So I think it really lends itself well to kind of making use of that. The other thing is on working with the VCS as well, I think in part responding to what Lynette put in the chat there, which is to say that we are working with Simone and as part of that implementation group. And I think clearly at the right time, we want to widen that and, engagement with the wider sector or those with particular interests around this. So we will continue to develop that. Come from our partnership is involved in that. And the final thing really is around the kind of services out of there, like debt and welfare and so forth. I think it would be good to see how some of this could pivot more into cost of living and how we deal with that, I think, because it's quite a big issue. And it wasn't mentioned directly, but if it could be, I think over the next year and 2 years, easily, it'll be an important matter to do. And lastly, I think on Rachel's point on the projects and the equity projects, I think this is a fantastic opportunity at a locality level to achieve this. And a couple of examples, I think, very quickly is on, for example, the childhood obesity work that's being done at the moment on the Henry program, but working also with GPs to make the referral there with children's centers or speech and language, or indeed some of the other empowering work like ABC parenting and so forth. So I think it's fantastic hub, if I may use that word, for some of these deliveries. Thank you.
Yeah, thank you, Jeffrey.
Thanks, Jeffrey. Yes, always good when you bring someone in who agrees with the chair. And actually, I'm really glad that you mentioned cost of living, because some who are on here will know that we're doing a lot of work in the council. And when we are talking about now, and we're talking about the winter, but we are talking also very strongly, and we've had strong indication from the leadership of the council, certainly, about the medium and long-term vision for that. And to me, it speaks to our approaches to anti-poverty, which anyone who knows me here knows that I see that intrinsically linked with the work of this committee and many others. So thanks for that. I'm going to bring in Zena now, and then I'll bring you in, Anne, if that's okay.
Thank you.
Anne and I go back a very long way, and Anne and I worked on the first Sure Start Trailblazer.
We did.
Now, although this is wonderful, it isn't quite Sure Start. It's a sort of Tory version of Sure Start, but it is terrific that we've actually got some funding, and obviously but this is different from Sure Start, and this only focuses really on a lot of perinatal and babies rather than the whole of the under fives area. But that, I think, it means that we absolutely have to work with all the health colleagues here, because so much of the perinatal pre-birth is all to do with going to see midwives and going to see the doctor and going to the classes and all the rest of it. So the fact that health is engaged completely in this is absolutely critical to me for our success. That's the first point I wanted to make. The second point I want to make is that the Triangle is a terrific starting point as a centre, not just because it's in the ward where there is the highest birth rate in the borough. We have by far the largest number of children being born in the South Tottenham and Seven Sisters area. So that means this is a really good starting point. But the second point also is it's an area of obviously great deprivation. And thirdly, it is surrounded by lots of other resources, which mean, in my view, I like to think of myself as a creative person, and I know Jackie and Anna and her team are creative. How we work this is really a canvas that we can do some terrific work with our schools. There are several schools surrounding the Triangle. We've got and the playgroups, the nurseries that are at schools, for example, and of course the Laurels, which is just down the road. So I think this is, and then as Jeffrey says, with the large Orthodox Jewish community who are crying out for support with our under fives, I think that we've got a fantastic programme to deliver here, and it really is up to us to be as creative as we possibly can, working with health and everybody and all the other partners to deliver a really outward-looking programme. I just want to say something that Lucia said. Actually, I had written, just as you were saying it, cost of living and warm welcome. We have been having a lot of discussions as councillors about how we're going to tackle the cost of living crisis, talking about advice services being in key locations, council officers who can do benefits checks and so on to make sure people are claiming. So all those things can fit entirely with all of this, but also we're talking about the notion of what we're calling the warm welcome, warm spaces, and of course the triangle with families and children lends itself entirely to that type of model. So I think it's coming at a time when it's absolutely needed. And even if it is a poor imitation of Sure Start, it is funding which is entirely welcome for the under ones, particularly in this borough. And I think if we don't get it right in the first years of life, we aren't going to get it right. So we all know this for years, and now we've got some opportunity to really extend the work, the fantastic work going on in our early years. So I'm really, really pleased officers have got, delighted we've got the funding, and I'm really pleased that the health colleagues here have sort of talking about that key relationship and all those services that surround early, pre-birth, birth and early years. That's it. Thank you.
Thanks. Anne, and then I think we'll move on to.
Yeah. Thank you. I've got 2 points to make. One, I think the first might be easiest, is about perinatal mental health. Of course, a family hub is absolutely important, but I think that there might be more work we could do around perinatal, mental health. And I think, Rachel, I'd like to suggest that we invite them to Sure Start as a starting point, because a family hub is not going to address those issues, but it is a contributor to that wider perinatal focus. The other bit I wanted to say about the perinatal mental health is their relationship with the social care assessment service. That really is an input where they see early issues and we end up in court. So I just want to be sure that through Startwell, we've got the right join and fit there, so that we're sure we're not missing anything. I also remember, finally, on perinatal mental health services, the work we did, I think, Rachel, you were part of it, when we had the JTI in 2017-18. There was a lot of work that we did there to be sure that, the hard to reach families were not hard to reach. It might be worth us, through Startwell, bringing up those old action plans just to be sure that they're embedded, because we know what happens with action plans. They all become blue and then people move and change and they might get lost. So just as revisiting that area to be sure, because we know it's one of the most difficult areas for us to work in for babies and, and mothers, and so on. That was one point. And then thank you, Councillor Dasnev. So I just wanted to sort of speak about the amazing support we have in this room for our family hub, but I do want to say that it is relationships for me that can deliver that ambition that we've got. It isn't just the governance structure. It is about everybody being sure that almost that locality area, and the plan we have is thoroughly networked with everybody supporting the family hub, and not just leaving it to the group that sit within it. And so if we can get those super brilliant, fantastic relationships across the piece, then all those vulnerable families and all the other boxes that Jackie and her team, and with the support of others, have to tick will be achieved and realised. It's all, that expanded set of relationships will help coordinate all the activity in that room. So I think we have great expectations for this work. And as it develops and mature, it'd be really good to see the impact and the outcomes that it's having. But and we've got a very strong platform. Jackie's chosen Triangle because of its very strong platform and a need to support our families and children, and young children in particular, from the Jewish community. So a group that is not always spoken of, the Haredi community. We will be able to swiftly access it. Thank you.
Thanks, Anne. Those are really helpful comments, especially around perinatal mental health. And I think everyone would support them, hopefully, here in the room. I'm conscious of time, so I'm going to move us on. But before I do that, I'm going to thank everyone. I'm going to say, I think, Jackie, there might be something as you're revolving, you might want to come back to us with a little bit about how we're going to measure outcomes, because you set out some vision for what we're working on, but we might want to see a bit more about the KPIs. And I also suggest that perhaps with your permission, we might organise a, when the time is right. Triangle sounds like a great place. I haven't been there before. Might be interesting to offer the opportunity for a visit for those who'd like to join. I imagine Councillor Branson would take us through what's happening there and what will be. So I'll put that as an action as well, if that's okay. Thank you very much. So
thanks, Jackie.
And let's pick up on, there were quite lots of points there. I know Naz will diligently send them back to us. So moving on to item 9 now, the Better Care Fund plans. And I think Rachel and Paul are going to introduce this item. I know Beverly will be, I should have said that at the beginning of the meeting, Beverly will be joining us, but she has another meeting, so will be joining us later, so isn't introducing this item.
Thanks, Councillor Desneves. I'll just, I'll introduce it and then pass over to Paul. What we've got is a paper that sets out some of the key highlights proposed for this year's Better Care Fund. People around the board will know that this is a joint fund, a Section 75, that we use in Haringey particularly to focus on the needs of our older residents. It's particularly to help us to provide an integrated response to our residents. And every year we are requested both to update our narrative, to set new trajectories and metrics by which we will be measured and our performance will be evaluated, and to agree and consolidate how we use our investments. So we do that through reviewing the schemes that we've got that are Better Care Fund funded, and in our joint board, our Joint Finance Performance Partnership Board, we consider the efficacy of those different schemes, and we hear and evaluate proposals around how we use any additional investment. So I'm going to hand over to Paul to talk us through it. Just before I do, just to outline what it is that's coming here and what it is that will eventually be signed off. Due to the timescale for publishing papers for the Health and Wellbeing Board, the Better Care Fund papers hadn't all gone through the processes that were needed in order to bring them to this board. So what you've got is an overview, and I think that hopefully makes more sense anyway, because there's quite a lot of detail in the supporting papers. The supporting papers are now ready and will go to Councillor Desneves for your sign off, and then for information round to the board, in the hopes that you get enough of a flavour through this meeting to then be noting those papers for information, because you've given the direction that we need and the acceptance that we need at this meeting. So I hope that makes things clear enough, and that you are able to ask sufficient questions on the narrative that Paul will present, so that it will help you to make sense of the more detailed reports that will follow this meeting. Thank you.
Yeah.
Thank you.
Rachel, if I could just pick up that's a really succinct kind of description of why it's come today, which is really helpful. And I'm just intending to go through the papers. I'm starting on kind of page 29 to explain. One of the questions you no doubt asking is, gosh, it's awfully late in the year to provide a 22-23 narrative around the Better Care Fund plan. Well, that's right, it is. Unfortunately, that's not our doing. It's a national issue. That the kind of guidance and templates came out at the end of August. More or less with a kind of a return date by the 26th of September. So we've turned it around as soon as we can. There are all sorts of reasons that why the national guidance has come out so late, which I'm kind of not going to explore, because we're as disappointed as you are to kind of see there's such a late date in the calendar. But basically, the information presented in the plan and in this kind of highlight report should give the board some assurance that we're maintaining our commitment to the health and social care integration agenda, and we're progressing. And I'm going to go into some of the kind of the highlights of what we've been able to do, because part of the other reason for bringing this presentation and the Better Care Fund plan to the board is just to highlight that you know, we've had some year-end successes, if you like, for 21-22, which we need to report back to the Health and Wellbeing Board. I'm going to come on to that in the kind of the end of the presentation. But basically, the kind of the Better Care Fund is a kind of an annual refresh that we do. It usually has a number of conditions associated with it. The kind of the 4 key conditions. Those conditions are that we spend a certain quantum of money in various ways, which I'll come on to in the next slides. But actually, the whole point of the policy is that we promote integration solutions that enable people to stay well, safe, and independent at home, and that we provide the right care in the right place at the right time. And for the kind of this year's summary within the Better Care Fund plan, we know that we had an additional level of investment within the ICB minimum allocation of 5.7%. And we also saw an uplift in the improved Better Care Fund plan, which is more of a social care direct contribution. So this table on page 31 summarizes the kind of distribution of funding between 21-22 and 22-23. And you could see there that the 5.7% I've mentioned for the minimum ICB contribution, say CCG contribution, will have its die-hard apologies, is 1.2 million nearly increase in that level. And the increase that's been on the IBCF is excuse me, is £288,000. So again, that's a 3% increase. So we were asked by what that means in terms of that's kind of Haringey's kind of contribution, and what that means in terms of the split between out of hospital commission spend and kind of what's called adult social care related spend. So in other words, the funding that is going across to adult social care to decide on to spend social care or preventative sets of solutions. As it says there, 7.3 million for the adult social care spend and 6.3 million for NHS commission spend. We are kind of in the kind of plan hitting that kind of information, well, sorry, that kind of level of contribution, but no more than that, because we're at kind of the minimum level, and we've been there for a while now. Our expectations are that of that 1.2 million increase in the minimum ICB contribution, 391k should be of the adult social care spend. That's how the kind of maths work out in this. And we have to submit back to the central team three elements. A Better Care Fund plan narrative, which I'll kind of explain a little bit of the detail around that in a couple of minutes. We also have to give them a schedule of investments and the metrics for the spreadsheet as well. We also have been required this kind of year to also produce a demand and capacity spreadsheet outlining activity and supply issues associated with intermediate care. And I think that's to reassure kind of central government that actually the pandemic and the legacy of the pandemic and the health deconditioning that's gone on amongst, you know, some elements of the population, particularly older people, hasn't led to us having a huge number of cases that we're really struggling to kind of manage within intermediate care. So obviously things are very difficult within the kind of the acute system. You just got to kind of, you know, that's true nationally as much as it is locally, but nonetheless, we've been able to kind of demonstrate that our kind of key areas of investment are probably going to be able to be supported in terms of the needs of the population as a whole, although there are one or two issues that we are facing in NCL and nationally as well. So I'm just going to touch on the structure of the narrative first and then go on to some of the successes, if you like. So we've structured the narrative around, well, first of all, our Aging Well strategy, which largely is funded through the Better Care Fund plan. And then we have a kind of a tiered approach to individuals' need within the Aging Well strategy and within some of the work we've been doing on Aging Well. And we have a care cone to respond to that level of need, which is like the little diagram you've got there. And basically it talks about people being as healthy, safe and well as they can. So a universal level of support, being able to access parks and so forth, as we all can as citizens, through to kind of people who need a little bit more help, early intervention and prevention, people who then start to need care and support. And then the final part of the triangle, like struggling to see, is what do you do in a crisis or an emergency? So we were invited to say, that's our kind of care code in our framework. And we wanted to emphasize in the framework the importance of a strength-based approach and a focus on prevention, self-management and personalization, because it'd be quite easy to get wrapped up into, we need to invest all of our money in an intermediate care response to kind of get people out of hospital in a timely way. And that's a really important priority, but it isn't the only priority that we've kind of got in this space. We want to put some funding aside into kind of prevention and early help. As I said, I've mentioned our challenges. So I've already mentioned one of them. Clearly, we need to respond to the legacy of the pandemic. And that's actually because we know that older people's physical health conditions and mental health conditions in particular have kind of worsened during the pandemic. There's a lot of evidence emerging around that yet, but there's still no kind of national research on what it means in terms of frailty. But we do think that actually the number of people with kind of moderate or severe frailty has increased by about 20-25% than it was pre-pandemic. We know that actually we need to keep that kind of our hospital system running as far as we can and facilitate safe and timely hospital discharge in winter, particularly to return people to home. And then our third challenge is actually making sure that we've got equity of access and outcomes and experience in the borough, particularly in the deprived areas and underserved communities as well. And that forms a section of in its own right of the kind of the narrative plan and the space we're doing around that, which I'll come and touch on in a minute. So just some kind of highlights of things that have happened. So many of you who on this call will know and been involved with the Aging Well Guide and the Aging Well resource directory on the council's website. So first of all, thank you for kind of socializing that and making sure that people know about it. That has been quite successful. We've gotten it, got a number of copies left, paper copies of the guide, but actually it's gone out to over 30 or more organisations, and we know that people are benefiting from that as well. We've seen actually during the pandemic a nearly 30% increase in the number of GP consultations for older people pre-pandemic and where we are now. Now that's a considerable achievement, and clearly there's been a mix of face-to-face and virtual consultations around it. But that level, that increase is quite substantial from our existing kind of resource base in the kind of the borough as a whole. And certainly that I'll come on to the impact of that in a moment, but we've also alongside that established now our multi-agency care and coordination team, seeing about 2,000 people who are kind of in need and actually have got complex issues that require multidisciplinary team involvement. And also we've got a specific team now set up in our enhanced health and care homes and our older people's care homes to manage the older residents on a weekly basis alongside our GPs. And that does seem to be working quite well. As I say, a lot of our activities are based around out-of-hospital solutions, and you can see there that we've been working together as a system quite successfully, I think, to kind of try and make sure that people can return home. So a big target for us is to make sure as many people as possible go home first approaches. 94% of acute Haringey patients do return home, and only 1% of those actually goes into a care home, because obviously one of the strategies that we want to progress is making sure that nobody makes a decision, or as few people as possible make a decision about their long-term care needs in a kind of care home. At the heart of that, within hospital rather, at the heart of that home first approach is kind of our reablement offer. We've seen nearly 1,700 people provided with reablement to help them recover their ability to kind of undertake daily living tasks during 21-22, and that's a 22% increase on where we were pre-pandemic. So we've also seen an increase, I'm not going to read all of this out, in terms of our rapid response function, which is kind of, if you like, bringing kind of A&E and support closer to home. Glad to say all of that has resulted in the number of emergency admissions in Haringey reducing by 22%, an unprecedented kind of level of a decrease, because we think that people are being, better served within the community. It's great to see, the work that the GPs are doing, for example, and other colleagues, and we could be relatively confident that if people are returning home, then actually they are being supported to recover as far as possible. So that they're a couple of our key performance metrics within the Better Care Fund plan. So I'm just going to very briefly touch on what we're spending our money on in 22-23. So with three areas of investment. As I said, early health and prevention, and we're building a community asset-based approach around a healthy neighbourhoods model in East Haringey, which we've kind of, I think we've been at the Health and Wellbeing Board to talk about that previously. It's a collaboration between the statutory and voluntary sector to support and engage with our kind of underserved communities on a range of issues, including improving long-term conditions. And the funding that's from the Better Care Fund plan is to support the voluntary sector in that space. We're also consolidating support for our community navigator network, and just to praise and embarrass the work that Jeffrey's been doing in this space with his colleagues around making sure that we've got a network, an effective network of people who are really active in connecting people to solutions they may value. And we're also want to increase the level of support for people with dementia as part of our Dementia Action Alliance, which is one of the things that we've not been able to progress as rapidly during the pandemic as we would have liked. The other two areas, proactive and anticipatory care, we've increased our investment in community health, and we've also moved into the Better Care Fund plan scope, our ICB community equipment budget, with a view to pooling the equipment budget in 23-24. The final area is inevitably crisis management and that out-of-hospital solution, and investing in those home first reablement solutions to meet the higher level of demand we've seen. But also to support those individuals who need a spell of recovery in a care home, for example, in a nursing home in Priscilla Wakefield in our case, to promote recovery and move on. So that was a brief run through of what's in the Better Care Fund plan. As I say, there are some documents to follow from this, but I'm just happy to pause there and take any questions.
Thank you. Peter.
It's less a question than an observation. So one of the reasons there was a reduction in admissions of the elderly was, of course, 2 years of pandemic. One of the common causes for admission of the elderly is a secondary chest infection, often from a viral upper respiratory tract infection. So here we are in the autumn. The NHS is girding its loins for a winter, which many think is going to be a very difficult winter. We know that over in Australia and the Far East, they've had a bad winter with influenza, and what they have, we usually get 6 months later. I know that out in primary care, they will be busy getting ready to do the annual flu vaccination. I think it's desperately important that we have a real push on this, a collective push on encouraging the elderly to have their 4th COVID or 5th COVID vaccination, their influenza vaccination, absolutely essential. It was lovely watching the pictures of the Queen's funeral, but all those people milling around just made me very worried as we go into a warm, tepid autumn, that we will see a huge increase in viral infections. So these are difficult times ahead of us, and the Better Care Fund will be under quite a lot of strain. I read today in the papers that 1 in 7 inpatients are there predominantly for social reasons. So we have a huge number of inpatient hospital beds that are still taken up with people whose only reason or main reason for being there is lack of social care, so that they can move outwards and homewards.
Thank you. Thanks, Peter. And we are going to come on to COVID, polio, and the flu vaccination. And I think you're quite right. I think we're a small band who still look at big groups of people indoors and think, oh, I'm glad I'm not there. But you're quite right. I don't know if Rachel or Paul want to say anything in particular around to Peter's comments. Otherwise, we'll absorb and.
Yeah, I just wanted to say really quickly, I'm not disagreeing with any of your analyses. I don't think necessarily that within our hospitals some of the issues are that 1 in 7 around social reasons. I would kind of query whether that's true of where we are within Haringey. I've go on the MO calls quite a bit in North Middlesex and in kind of Whittington, which are the kind of calls that try to help with the discharge of individuals. And what I would say is we've got fewer admissions to hospital. Many of those people are more acutely ill and have got like more complex needs. So I really do think that there's kind of something there about some of the underlying causes that are maybe it's a combination of people having exacerbated health conditions due to kind of so some of their social circumstances, for example, living in damp and mouldy accommodation, etc., etc. So I think it's a bit more nuanced than saying it's a, I know you didn't mean this, Peter, but kind of a social care kind of case. It's a whole set of reasons around it. But I think within our local system, I don't see as many social reasons for kind of admission. They tend to be very medicalised.
Thanks, Paul. I had a couple of questions, and then I'll bring Will in, if that's all right. And actually, one follows on, I think, quite well from Peter's comments, which is around hospital discharge, and certainly what I've seen in my inbox a bit, and we've talked about this, Rachel and Paul, but just to bring it to the fore and bring it to this committee, is where we're seeing discharge from not our usual partners, not North Mid or Whittington, and some of the challenges there. And certainly I've had some quite tricky cases come past me around that. So just about how we can develop those relationships and make sure that's working well, because I've seen some cases where it really clearly isn't. And I think I'd add to Paul's comments, just also based on some of the cases I'm seeing, is that people are also leaving hospital somewhat, perhaps not having had the occupational therapy. I can't think of the word now, but certainly perhaps not as well and ready for re-ablement as they might have been in the past. Perhaps they've been in bed a lot more. They've lost their ability to toilet themselves, whereas they were able to when they went in. So I think those are big challenges. And again, I'd highlight there are even bigger challenges with partners who are not here or who aren't as close to us, because we aren't able to have that dialogue around that. So, and I've certainly seen some very sad cases recently like that. So I just wanted to bring that. I'm not expecting a response, but I think that's a really important part of that conversation. I had a question / comment around dementia, and what often comes up for me is that, of course, we have a hub in the West, and I know that we've done a lot in the West of our borough. I know we've done a lot thinking about outreach, but we know that in the East, we don't have that hub. And so just asking how we're making sure that we're really embedded in the communities and people feel they know how to access, and they know what to look for, what the progression of conditions, etc. I also had a question about the Aging Well Guide and how we're measuring success and how widespread its usage is. And the only reason I say this is because whenever I go anywhere, there are only two things people talk to me about. One is primary care, sorry about that. And the second is we don't know what's available, and we want more information, even online, so that someone can help us or access. So just about, I know that the Aging Well Guide has some information about where to go for help, but just relaying that's a big focus for people that don't know what's available always in the borough. So just checking in with that. And the final one is a bit of a broad question, just around how the Better Care Fund, how we're focusing it so that it helps us tackle. I know it's on your mind, Paul and Rachel, all the time, how it helps us tackle the real priorities of the things that we think will make the most difference for our communities, especially those who are experiencing the most unequal treatment or are the least well served. Sorry, that was quite a mouthful.
Rachel, should I start, and then do you want to chip in? So yeah, so just to start with the last question, and then work backwards, I guess. I mean, you're absolutely right. There is an entire section on the Better Care Fund plan narrative, which talks about addressing equity of access and outcomes and experience. And it's an area that we've invested substantially as an ICB in through our Inequalities Programme Fund, in addition to the Better Care Fund plan funding that you're seeing within it as well. And actually that is focused on the east of the borough and the 20% most deprived. And what we've done, as you know, is to take a kind of a resident focused lens to it, to say these are we're looking at predominantly the same residents, but there are a number of different strands of issues that each of those residents face, depending on, where they are, in their life journey and so forth. So there's the kind of themes include things like having a best start in life, improving long-term conditions, improving mental well-being, and so forth. So we really need to make sure that we continue to build on that as an integrated care board, because it is part of the NHS plan's responsibility to make sure that we better serve communities that would otherwise be underserved, if you like, and that's what all the evidence base has said has happened during the pandemic. So the Better Care Fund plan plays its part in that, but it isn't the sole vehicle around it. And so I'm delighted to say that we've agreed to put some funding from the Better Care Fund plan. I mean, I think we're ahead of the curve in terms of many other boroughs in doing so. But it's something that we want to start investing in over time to make sure that we do two things. First of all, to make sure that we actually are investing in those groups and solutions, but also to do it the right way. So part of the Healthy Neighbourhoods approach that we're taking is about community empowerment, involving the voluntary sector, investing in the voluntary sector as well, to be that connection and link between partners. I can say I've simulated some interest, so I don't know whether to pause there and hand over to Jeffrey, because he's going to ask a question, I think, about that or not.
Shall I bring you in, Jeffrey, if it's on that topic?
It's a bit of that. Yeah. Thank you, Paul. I just want to say that, yes, I think the Better Care Fund is a fantastic program, I think, because it does pick up on a lot of the stuff that is around health and social care, but also just people recovering in the community. So, and we have seen, for example, that in terms of if I can talk about, avoiding hospital, or indeed getting people out of hospital quickly, like Peter was saying there. And one of the things we've seen is, for example, on the home from hospital, it used to be that there were only people coming out of Northmead and Whittington, but we are now seeing actually referrals coming from either hospital as well in the kind of NCL area. It kind of, I think, tells you how the system is working together. But also we kind of, to be more responsive, to try and also avoid hospital admission where possible, is that they self-referral as well. And actually nearly 30, or probably quite a big percentage of that is now self-referral, which never used to be the case. And again, I think it shows you how the system is also working and bringing mental health a bit more in as well. And my last point is, there's been a lot of work. I just wanted to comment, Paul, on the achievement that you are doing there. The Aging Well resource, I think, is a fantastic one, really good. We need to get it out more. I think, I know Lynette will send you plenty of those, yeah. And so I got distracted. Someone just brought me something to eat. My absolute apologies. And lastly, Paul, in the, you've resolved the question around the timing for this, because I feel like we're reporting rather than doing that. But can I ask a question? What does it say then? Because we are nearly out of this year. What does it say about next year and whether there's continuity as well? Thank you.
Okay, so yeah, so if I take that question then, I mean, obviously, when we write these things, because this isn't the first time it's been delayed into the kind of the middle of the financial year, we tend to write it with a view to saying, well, this is what it might look like in 2023 in this case. So what you may have noticed in me going through the new and expanded list, Jeffrey, is actually that there's consolidation of funding rather than we're going to support something new. So what I'm going to propose is that we continue with that narrative, if you like, for the next financial year as well. So again, that means that we're maybe putting more funding in the specific areas. I can't necessarily guarantee that at this point, because clearly we need to go through a cycle of coming to a conclusion between commissioners, because we don't know, for example, how much money will be available next year from the Better Care Fund plan. But I think it's a safe bet that we can kind of make sure that there will be some form of uplift, and we can spend our time during the remainder of this year planning it wisely where those investments are. But I think actually it's about building on what we've already got rather than putting things in something new. And that kind of leads me seamlessly on, if that's okay, Councillor De Neves, to kind of answer one or two of the other questions you mentioned as well. So I think some of the things that we are looking at are I mean, if I touch on the dementia question first, that role that we mentioned within dementia, for example, and one of their roles is to encourage organisations to work out what they can do. Is that part of that social model of dementia and ageing, which is great in its own right. But we also want that person to kind of raise awareness and work with the community protects model that Jeffrey and other colleagues have kind of set up to go into specific communities we know are under, will under kind of recognise, if you like, kind of dementia and cognitive impairment in the first place, to begin to address that. So it's something that we had on the plans, and then the kind of pandemic came along, and then we've had to put it on the back burner up to this point. So it's really pleasing for me personally that we're able to accelerate some of the plans around that. I think the other points you raised there are completely right about what happens if somebody's in a kind of an outside hospital, outside of kind of the usual kind of two that we have. I think we need to improve our kind of discharge processes. I think we have got a network of support between what's called our integrated discharge teams, so that actually people who are Haringey residents who happen to be sitting in UCLH, for example, in London, are flagged as needing a discharge, and then the planning arrangements kick in as though they were in North Middlesex or whatever. But kind of hand on heart say that actually we don't need to improve that. I can't. So we definitely need to improve that kind of to make sure that the discharges are more seamless and timely than they are at the moment. And I think the other thing is it's not just you, Councillor Deneva, several other people have kind of highlighted to me and colleagues in the acute hospitals around concerns over, deconditioning, let's call it that, within kind of the hospital wards, and we are going to take that forward with both of our nearby acute trusts, because we are quite aware of it. I mean, what I would say is clearly there are a number of challenges which I hinted at in the kind of the pack. So alongside the kind of the pandemic, there's also kind of recruitment and capacity issues within kind of staff, just sheer burnout. I could go down the list and depress everybody, but I think you all know what the kind of the landscape is at the minute. But we are looking at where we're trying to, for example, trying to get a therapist between, let's say, Whittington Health, community arm, and the council. Well, why are we competing about that? Why don't we join forces and kind of work out how to best kind of support one therapist between both organisations? So yeah, I am hopeful that we've got some plans set out, which is in the kind of the narrative plan, a little bit more detail around what we might do in 22, 23 and 23, 24.
Thanks, Paul. And yes, very helpful. That was the word I was looking for, deconditioning. I always forget that one. And I think it's really heartening to hear also that we are thinking about how we work on those workforce issues that we've talked about so many times here. I think it only but makes sense that we collaborate together. So I know Will has been waiting really patiently and wanted to come in.
So I'm okay now. Yeah. Because discussion's covered it.
Okay, well, that's great. If that's okay, I'd like to move us on because we've still got quite a lot on the agenda. Thank you very much, Paul and Rachel. And as we said, we're then going to take this outside for ongoing work and discussion as Rachel set out. So thank you very much. Thanks, everyone. So moving on to item 10, healthy place, health in all policies. And Katrina, you have arrived. Are you presenting it, showing?
Hi everyone, yes, hopefully my screen is popping up now. Can you let me know if you can see that presentation?
Yeah. Yes, we can.
Perfect. Hopefully you can see in here as well. And Susan's going to start.
Good afternoon, everyone. We wanted to share with you the progress and an update on our healthy policies subgroup that you gave confirmation of establishing a while ago. So if we have the first slide, Katrina. So the Health and Wellbeing Board signed off establishing this subgroup back in November 2020. So we had our first meeting in Feb 21. And what we've been doing is we've been meeting every 2 to 3 months and we've had sessions focusing on a number of topic areas around embedding health in all policies across the partnership. And also part of the work is looking to reduce health inequalities. And also what our work does is it feeds into the Place Partnership Board, which is part of the Haringey suite of partnership boards. So that's how our governance works, as well as reporting to yourself as well, and also to the council's own discrete place board as well. So that's just to set the scene for you of how we've set up and how our governance has worked. So what Katrina's going to do now is to go through some of the highlights that we have worked on over the past few months. So over to you, Katrina.
Thanks, Susan. So just to continue with the introduction, the overarching objective for the group is to create and develop healthy and sustainable places and communities. The same recommendation made in the Marmot Review. And we are working to improve environments around schools, air quality, green spaces of all sizes, housing quality, accessing healthcare, sustainable active transport, and social connectedness. So in our discussions, we look to ensure health impacts are taken into consideration on developments to prevent widening health inequalities. We work to influence local policy to promote healthy placemaking, and all of our objectives are aligned to the Haringey Manifesto. So this is just a quick visual of some of the members from our group. The latest to join was the Chief Executive from Disability Action Haringey, and he's been a great add-on to the group so far. So some of the impacts we have made today include sharing information that will aid planning's draft local plan and the leisure services review being conducted currently. We've worked collaboratively through follow-up conversations from sessions, which has included between colleagues working on North Mid development, and our colleague Kat from Living Streets, and they've discussed the possible implementation for the Clean Air Hospital framework, I believe. The offer of training also, so from Disability Action Haringey, they've offered to train us further on the social model of disability, and we have been sharing ideas, for example, on the best location for accessible parking on a hospital site. The table on the left shows topics we've covered in the last year, so that's included low traffic neighbourhoods before implementation, the draft housing strategy, and plans for the Selby Urban Village. Oh, my laptop's jammed. Oh no, here we go. So the longer term outcomes as a group include continued exchange of expertise and knowledge, a strengthened partnership around place in Haringey, input on key strategic documents, for example, the draft walking and cycling action plan, discussing how ambitions such as 81% of residents living within 400 metres of strategic cycle networks by 2041 will be reached. It's currently 17%, so a huge target. And we're also working on aligning our work through a collaborative approach to improve the health of Haringey residents, by incorporating health considerations into decision making across different sectors and policy areas, and working with community groups such as Haringey Cycling Campaign to gather intelligence on important issues to them. So another key outcome for the group, as mentioned throughout, is partnership working, particularly with our VCS across Haringey that brings different voices and views and really help shape our discussions. We have invaluable valuable insight, sorry, from Living Streets, whose mission is to achieve a better walking and cycling environment for everyone, from the Selby Trust, who represents many local communities from different backgrounds, ethnic groups, ages and faiths, and Disability Action Haringey, who supports and represents disabled people in Haringey. So the group encourages new connections within Haringey Council with different teams and also with different communities and other voluntary and community organisations too. A question we do have for the group is what new members we could have. Are there any groups that we are not speaking to currently that you could suggest or put forward, as we're always keen to expand? And just to conclude, so for future meetings, we are looking to cover the joint strategic needs assessment on place that Public Health are producing, and we will hear updates on work such as the Healthier Catering Commitment, the Leisure Services Review and the Air Quality Action Plan. We will continue our positive conversations, ensuring meetings are fostering opportunities to share and input. And we will look to invite resident groups as much as we can to input on relevant topics to them, such as the work we did with the Haringey cycling campaign. As I say, we are very interested on new connections you can put forward, so if you can let us know, that would be much appreciated. But thank you for your time, and let me know if you have any questions.
Thanks very much, Katrina. Councillor Brooks.
I've never heard of this group before, so it's quite interesting to get an update on what we've been doing. But I am surprised, I have to confess, on what I think is quite a narrow parameters. There's nothing I wrote a note for myself. What about culture? What about our libraries? What about cinema? You were talking before about having, I don't know, what was it? A healthy, I wrote down, healthy neighbourhoods in the east of Haringey. Well, I live in the east of the borough. A lot of it isn't that healthy, really. It's very polluted, and I live nearby about 38 stories of tower blocks everywhere, pouring out whatever they're pouring out, buildings. So it isn't that healthy in some ways. But I am surprised that there's nothing here about people's reading or learning. We have Haringey Adult Learning Services. We've kept every library open in this borough. St Anne's Library has a hall, it has a kitchen. That we've got this project with Edible London, where you could have all sorts of activities going on, right in the heart of South Tottenham, not very far from the Triangle, or the Laurels. I just really feel that perhaps you're missing a few tricks here, and I'm sorry if I'm being a bit blunt, but it really did just hit me between the eyes. We've worked so hard to get our libraries, keep our libraries open. We've worked so hard to improve them, investing a lot of money in new spaces, in meeting spaces. Our Stroud Green Library has nowhere for people to meet in the Stroud Green area. So now the rooms are available. And I just think people's intellectual and mental health is important. I get the cycling campaign and I get living streets, but there is a bit more to our well-being than that rather narrow prism. So I hope you take that in good part. And I would like to see you link up with our libraries, especially, I would say, Marcus Garvey, St Anne's, Coomscroft. These are resources, and all other cultural resources that we have. We don't have a cinema in Tottenham, for example, but if you lived in Crouch End, you could go on a Monday afternoon for a few pounds and have a cup of tea at the Picture House. It's a very different world. Wolsey Library has a cinema. It's a very different world that we could perhaps do something to enrich. There used to be a group, like I say, one final thing, Jeffrey will remember this. We had a group in Tottenham when I worked on the NDC called Older and Bolder, which was an elderly people's group. And they used to meet in what was, we referred to the Scout Hut on Templeton Road, which is now housing. And people really loved it. And they were really upset when that group went, people are upset with their lunch club to me. You know, perhaps we need to relook and rethink. We've got resources and we have a very hard winter coming up. And there's perhaps some opportunities there.
Thanks, Zena. I think it's a point well made, and I had listed a few things, so I might just add to that list. So, and I think you touched on food, and it happens to sit alongside some of that culture portfolio now with Julie Davis. But I think food's quite an important one, both access to food, but also it's a great celebration. You can't go anywhere in Haringey without people serving you some amazing food, honestly, but also without having conversations about that. And at the same time, the difficult, you highlighted the challenges, which is right now cost of living means for many people, they don't have access to good food. So I think that's a really strong topic. Some of the other things that were on my mind were a bit more, I think that what we're talking about when we talk about the placemaking agenda, what is the street scene like? How does it feel to walk in a place, and that broader environment? I think that's probably what you're hinting at, Zena. But I think we can't avoid also the impact of antisocial behaviour on people, how it feels to live in a place, what that's doing to people's mental well-being, and how we look at that and think about that and address it. And I would add drugs and alcohol as well, and how, again, when things are overspilling a lot, and that has impact, and obviously clearly those individuals are not okay, but not necessarily okay, but also how that feels when you live alongside that. So I think those are all really important areas that we could be thinking about more broadly. Sharon?
Yeah, I mean, my questions are a bit similar to Councillor Brabazon's, really. I mean, what is it? I've not heard of this before. Where has it come from? What is its remit? Is it doing anything that's not being done elsewhere? Is it duplicating work that's being done elsewhere? Who is involved? It's rather a strange selection of participants, most of whom are council departments in somewhere or another. Then you've got one community centre, one group, Disability Action, represents disabled people. No one from Health Watch, I think, knows about this. We've got a lot of contacts. We also have something called the Joint Partnership Board, which represents a range of adult social care users who I'm pretty sure have some pretty strong views about some of the issues which you appear to have been discussing. So those are questions that I would have about the whole remit and auspices of this new setup, without wishing to discourage anybody discussing some of the issues involved, which are quite important ones. I'm also a bit concerned that a national organisation, which is Living Streets, appears to be part of this, as opposed to a local group which looked at those issues. So those are my questions. Intrigued.
And they're good questions. Thanks, Sharon. I think it might be the local branch of Living Streets, but I think to tell us. I think Katrina, do you want to come in on that? And then
I should have emphasised it is the local branch of Living Streets. It's the Haringey members that sit in.
Lynette, do you want to come in?
Yeah, I couldn't support enough what Sharon and Councillor Zena said there. Really surprising that we're talking about health, but we don't have any mental health in there. And some of the faith groups, we've got over 50 groups in this borough. Yeah, so if we're getting a sense of what it feels like to live here and walk the streets of Haringey, we're missing some of the Haringey people that live and breathe how it feels. Also, what Zena said there about the regeneration, often when I walk around Haringey or certain parts of it, I'm surprised at the lack of nature, etc. And then we have other parts that we've got lots of nature and parks going on. So it's about how we can replicate that, because when we're thinking about health, sometimes it's what you look out at your window and see, and that doesn't seem to have been picked up here. The other thing is safeguarding. There is absolutely hotspots in this borough where people are more vulnerable, etc. That also seems to be missing from this group who are going about this really important work. And I'll just make one other bid. Housing literally comes up in our work at Mindy and Haringey daily, probably several times a day. And that is people reaching out to us saying that their mental health has been affected by their housing environment. So again, I'm just wondering why some of that isn't being inputted into this. And maybe some of the other health partners, I'm thinking about primary care and how many social prescribers and connectors and others we have in those spaces now that could tell you a thing or two about some of the agendas that you're speaking about here. So I kind of agree with others. First time I've heard about this group, but also that the membership looks very limiting. And it seems like, yeah, it's dominated a lot by groups that are already in the council. And we've already spoken about how much we need to really bring the community along when we're affecting these changes and trying to ensure that they have a healthier life, whether that's based on the place they live or generally across the borough. So really would echo other people's concerns about the membership of the group.
I'm going to bring in Peter and then I'll bring in Susan and Marlene.
I can't resist the opportunity, Chair, just to mention that in the space of a few weeks, we've had 2 positive outcomes in Haringey, in that we've had 2 fit for 21st century healthcare health centres which have opened, which represent a huge amount of work on behalf of the local NHS and the council to bring these to fruition. One is in Muswell Hill and one is in Green Lanes. And that is, to me, a huge cause for celebration. Wonderful, positive outcomes.
Thanks, Peter. Absolutely. And Councillor Brabazon and I went to visit I should share that, the new West Green surgery, and what an impressive site it is, and what an impressive bunch of people. I would add to that and say, Peter, how amazing to have a GP practice run by 3 men who grew up in this borough, born and bred, and now leading healthcare. So I think we actually talked about what a positive story that is and how much we would like to see that promoted and actually shared to inspire, because it certainly inspired me to inspire.
Just
so thank you for mentioning that.
Thanks to Owen.
Yes, we should indeed.
Made that happen behind the scenes.
We should. I think we should record our thanks to the team. So that's a really positive outcome. And I think there's lots of potential, and it shows that I think Zena always talks about potential for a space and place and how well we should use places. And so now we have more spaces where health enhancing activities can take place. So thank you. I'll just bring in Susan and then Marlene and Rachel, if that's okay. So Susan.
Thank you. Just to say that back in November 2020, we did come to the Health and Wellbeing Board with the suggestion of setting up this subgroup and what its remit would be. And as I said in the introduction, the Health and Wellbeing Board supported the setting up of the group. Maybe what we could do is we could send around the terms of reference for the group. What we can do is take on board the suggestions that have come through, particularly on the culture piece, that we can look at that. I know that the public team by itself, this is not about the partnership, the public team by itself, we have been working with the library management about increasing its offer to communities, because there is evidence to show that if you have a range of books, particularly around low-level mental health issues, it's kind of books on prescription. It's a national I can't remember the name of it, but I know that the libraries do that now, and thinking more about using the libraries as a social space as well as a, providing a service as well. But in terms of the partnership, we will certainly take on board your suggestions, as I say. We will certainly take on board your suggestions around the membership. And, we would really, welcome your support in identifying people who can give their time to this, because as you all know, people's time is pulled on in all directions, and it's sometimes the same people can be asked again and again to join groups, and that just pulls more and more on the time. So if there's other groups that aren't involved in things, we would definitely welcome them in and want them to help us with shaping health in all policies. Particularly, we've been, working a lot on the big planning developments, but we're also working on the other policy areas as well, as we said, with the walking and the cycling, but certainly take on board the suggestions that you've made. So thank you very much for that.
Thanks, Susan. Marlene, Rachel, and I know Will would like to come in as well.
Yes, thank you, Chair. Just picking up on a comment Lynette made about housing. Housing is involved. Prior to housing coming back into the council, they were external to the council, so we do have a representative there. We are also in contact with other housing, but it would be amazing to have a social housing a representative around the table. We're always reaching out to different people, but as Susan said, it's time, because people are on so many other groups, and we're trying to make sure we get new voices and voices that are not always heard. And I remembered when we first started the group, I think Jeffrey kindly took group membership to the voluntary sector to see if anybody wanted to join. I can't remember if Jeffrey remembers that. And we didn't get much response, but people are coming out of COVID, so they were already under pressure. So we understand that. And I think that's why we're reaching out again, because we're expanding, looking to expand the membership, particularly from the voluntary and community sector.
Thank you. Thanks, Marlene. That's helpful. And I'm just before I bring Rachel and Will in, and we do have to move on as well to have another item, but I'm just going to suggest that I think what we should do is perhaps take on board some of the comments that have been made today, and explore. We've had a kind offer in the chat, and Sharon's mentioned Health Watch, kind offer in the chat from Lynette about minding Haringey, and just have a bit of a regroup, take on board that feedback, and perhaps come back in a few meetings' time, having brought that together and thought a little bit about some of the questions and challenges that we've had today. I hope that feels like a way forward, but I'll bring in Rachel and Will.
Thanks, Councillor Desnos. Just to add, or another question or suggestion, I mean, I sort of sympathise with you about the challenge of trying to involve people from different groups, because it's often quite difficult to get everybody around the table, and it's often quite a commitment from the same sort of organisations who we ask for input in lots of different areas. I just wonder about how it seems like you've got quite a policy orientation, so it's about health in all policies. I wonder about the practicalities. So I guess what I'm thinking about is our GPs. I was thinking about primary care involvement, you know, and what's the right connection. And our GPs quite often come to me with things that they're doing, things like gardening projects, things like walking groups, and they say, where do I look for sort of soft funding, grant opportunities, How can this be supported? Can health support it? Can the council support it? And I wonder just about whether there's more of a kind of practical support, networking, connecting, finding opportunities for organisations and health professionals to access funding or input. I think that quite often that's what people really want, and it might be just spreading your remit too far. But I do think it's a bit of a gap in our borough, and would really help us to kind of thrive and build on people who already have demonstrated that they're kind of taking that health in all policies approach.
Thanks, Rachel. Will, shall I bring you in, and then I'll bring Jeffrey, and then I'm going to have to move us on.
Yeah, I was just reflecting on the conversation. I wanted to say thank you to my team, Susan, Marlene, and Katrina. I think the question here is about scope. So I think there has been some really positive work, making sure we're getting the basics of kind of health feedback and technical expertise, mainly focused on some planning and policies. What I'm hearing here is actually the ambition of the Health and Wellbeing Board to influence wider determinants of health. And actually a lot of the work, you mentioned food, for example, there is lots of work going on food, there's lots of work going on cost of living crisis. So I suppose it's how we get sight on that, because this is actually slightly different to all the work that's going across the council and partners. So I think that's the question for the Health and Wellbeing Board. There's a question about this group and how we make the most of it, but there's a bigger question around how we influence the wider determinants of health, how we link into other parts of council governance, how we make sure other parts of the council community are aware through, for example, joint strategic needs assessments. And do we want to kind of focus on the whole thing? We could, as we've so many areas have been mentioned, or do we want to kind of sponsor 2 or 3 areas as a Health and Wellbeing Board, and then actually bring in other leaders who can link into us? Like we don't have our director of housing and planning, for example, not sitting on the group. So there's a few. I think there's a broader questions that this brings up.
I think there's quite a lot to tease out, and you're right. And also my own personal perspective on these things is that I do think we and health perspective has something to say about those things. And actually, or put another way, sometimes if you sit around the table and that isn't there, then we see gaps or we see issues arise because we haven't had that conversation, we haven't brought that dimension in. So, you know, I'd send you everywhere, Will, because I think actually in all those places we should be having that conversation. But also there's something about how we enable other colleagues who outside here to feel they can have that and bring that, and how, so part of it's about how we cross work and how we educate's probably a bit of a strong word. But I think maybe there's more for us to talk about outside, and to bring that back if people feel happy with that. I'm going to bring Jeffrey in, hoping that he agrees with the chair, but just kidding. But and then I'm going to move us on because I want to give the next 2 items enough time.
Thank you. I actually agree with the chair, by the way. Thank you, Suzanne, and thank you also Katrina. I think it's quite a difficult thing, really, isn't it, to try and talk to everybody. And I think I want to make perhaps the bigger point, which is if you look at the partnership, I think I agree with all my previous friends about the narrowness of that. And I can't possibly say that I've never heard of this, because I have, like Marlene pointed out. But the thing is this, that it makes the bigger point is, how do you engage with the VCS in particular in this case? You either invite them and they come to you, or you go out to them. I think clearly it's going to be difficult for them to come to you in the kind of time and when you want. So I think the bigger point is, what strategy do we have as part of engagement to go out to people and speak to them? And quite often we do engagement, but we don't put any particular thinking or resources into that. And whether that's your own time, or whether that's you're getting pay somebody to get the time to do that. Do you get my point? So I think it's not just, otherwise we're just doing as normal, ticking some boxes, which we are actually not getting effective representation of voices. Now, Selby there, I can see why they're there because of the, development work that they're doing. But again, I would suggest that's a very locality placed view that you'll get from them. I can see why disability action is there. Again, very good, but again, that's a very disability-friendly perspective you'll get. It leaves quite a wide area, I think. So there's something about how do we go out to all these different people and, you know, simply quite put the resourcing there. The other thing, which is I think missing in this equation, is resident participation in the policy making or shaping. I haven't seen it anywhere in the presentation. Is it there? And if so, you know, where friends of parks, where this and that. So again, if they can't come, can we go to them? So I think that co-production is probably isn't the best example, I would suggest. But I can see why we're where we are, but we need to be more creative and put some more time into it. Other than that, thank you. And I've not even talked about low traffic neighborhoods, yeah, which I'll try to leave out. Thank you.
Thanks, Jeffrey. I'm not sure about you ending your speech there with some swearing, but anyhow, in all seriousness, I actually want to thank the team for bringing something and provoking us. I think that's a good thing. And also know that it's quite a great. It's really hard to do cross-working. It's really hard to work across and to bring, you know, bringing health into planning and those discussions. I think there's a lot there. So I thank you for doing that. And so we've got clearly there's quite a lot of ambition here. We're ambitious on the work we want to do. We want to see public health being across everywhere. I ideally support that, but we just need to think about how. And I think Jeffrey's point about resourcing is really a good one too. So I suggest we take it away and we'll talk more. But I want to thank the team as well for being provocative, even if unintentionally, but also for working hard to work with on the particular areas you are doing, because I think that is valuable and important to us. So thank you.
Thank you.
And move us on to the next item, item 11, COVID, polio, and flu vaccination. Will.
Right, I'll just give a really quick update on these different programs. So I'll start with polio. So as you're probably aware, polio virus has been found in sewage in London, with Haringey being one of the boroughs impacted. We haven't had any clinical cases of polio as yet in London. It's really unusual to see polio virus in sewage. It's from the vaccine-derived polio, so the oral polio virus that's given in other parts of the world, not in the UK, is a live vaccine and can transmit. We have seen a case of clinical polio in New York in someone from the Jewish community, and there's also been polio found in sewage in Israel. So there is some concern around making sure we protect Jewish communities who are highly mobile between those different locations. And then there's a wider factor around protecting the wider community from polio. So as a result of this, and really as a precautionary measure to prevent transmission and spread, the JCVI, the Joint Committee on Vaccines and Immunisations, has recommended, firstly, and most importantly, we make sure all children are up to date with their immunisations. So there's lots of work going on in primary care to support that. And secondly, that all children aged 1 to 9 are offered an additional polio booster. And how that's happening, so that's happening, there's mobilisation through primary care. So again, tremendous efforts from our general practices on top of all the other things that they're doing and other vaccination programmes. We're also doing vaccinations in Hornsey Central. We don't have the uptake numbers yet. There have been some really successful days in terms of uptake, but hopefully we can bring to a later board the uptake in different parts of the borough. We're not expecting a really high uptake from this programme. The risk remains low to the population. So that's where we're at with polio. And just to be clear on that, vaccinations won't be delivered at school for polio. They'll be delivered through primary care and outreach. We're also doing some particular outreach into the Orthodox Jewish community, working with Hackney. That's polio. Then the COVID and flu vaccination programs, I think Peter has already done my bit in saying how important they are this winter. Flu, so we know from Australia, which has its flu season before us, they have an early flu season. They have quite a significant flu impact in Australia, as we're seeing the changes in behaviour after the pandemic. So for COVID, I'll start with COVID. So COVID vaccinations are for vulnerable people, so over 65s to people in other risk groups. Offer is through general practice, pharmacy, and various locations in the borough, including Lordship Lane, Bounds Green, and Hornsey Central. Flu, again, initial focus is on over 65s and other vulnerable groups. Pharmacists have already started stocking the flu vaccination, and the GPs will begin inviting people in. The difference with flu is it's normally focused on individual GP practices who do their invitations. There's also a school-based program for flu, which goes from primary right through secondary now, and the significance of that is to prevent transmission in the community. Children aren't at particular risk from flu. So I think that the key messages for me is we've got to keep on promoting these vaccinations for all different parts of our communities, which we're doing. We've got to understand the pressures that this is putting on our primary care workforce and get behind our primary care workforce in delivery. And then also the hospital trusts and other employers of health and social care staff. It's really important we get a good uptake of flu vaccination in our health and care staff this year. And I noticed we've got Natalie and Helen on the call, who I'm sure are thinking about their programs in their staff groups.
Thanks, Will. Just before I bring Peter in, is it worth also mentioning, because I know it's on lots of families' minds, the vaccination for young people, for those who haven't had one or two, because I think for a lot of parents, they'll be thinking about, well, we are in my house, they won't have had their children vaccinated for COVID for their first jab. So just emphasising that as well.
For COVID?
Yes.
So there isn't. So what's happening? You mean what the offer is for COVID for young people?
Yes, exactly.
So the JCVI are not recommending COVID vaccination for children and young people during the spring campaign, partly because it's sort of changing in risk context.
Okay, so are you saying they're not recommending it if children haven't had a vaccine already?
So I need to check around access. Yeah. So I think you can still access it, but they're not doing an additional boost.
No, that's what I meant. Just meant access. I just know a lot of families won't. Their mind won't have been on it in the summer, but it is now because they're in autumn. If that makes sense. Yeah.
Noted, and we'll make sure that information is provided.
Okay. Peter.
Yeah, I just wanted to ask Will. I mean, I absolutely take Will's point that the risk to each family is low in terms of polio, but presumably there's a proportionally higher risk for the refugees who've come into the country, often from places where the normal vaccination program has been disrupted. Mm-hmm. So I just wondered if we're getting any sort of data yet to get a feel as to how many of those refugees are behind with their vaccines and how we're doing in terms of the catch-up.
So I can look into that in terms of data. I know we're doing quite a lot of work on providing wraparound support for people from Ukraine and other refugees as well, which includes registration with GP and a focus on catch-up on routine vaccinations. It's one of the most significant things that we can do for people come is to provide them with those routine vaccinations which they may have missed. Yeah, so happy to provide some information on that outside the meeting. That's been the next meeting.
Thanks, Peter, and that's a really useful point. You'll know that we've got a welcome advisory board that, and actually Christina is on the call, so she can remind me at a later date. We're due to have a whole conversation around health and our refugee and migrant communities at a coming health and wellbeing board. Welcome advisory board. So I think that's actually quite pertinent. So thank you, Sharon.
Yeah, two things. First of all, I mean, are there workforce issues around administering the vaccine program, both flu and COVID and polio at present? So that's one question. The other question is whether or not there'll be support for the work which VCS, Healthwatch, and I think Mind did during COVID to try to promote vaccinations to often excluded groups or to reach groups, a phrase we don't really have to use it out, you know what I mean. So two questions there.
Yeah, so I think on the workforce, it's always a challenge, but actually the demand isn't as high as in previous waves. So I think we're meeting the demand. It'd be good to get Peter's perspective from primary care, because the workforce is hugely stretched across a number of different areas in primary care. Then on the support, we don't have the additional funding that we've had in previous waves. So we can't put additional investment in specific programs, but we continue to work with your organisations in terms of just general engagement. But no, we don't have the
There's no money coming from government
There's no
in
money.
the light of the concern.
There's no additional money coming from government.
So in the workforce, would you be using like volunteer vaccinations that you did during COVID? Would you be calling on those people?
I don't think so. I think it's just through core staff. I've got Rachel and Peter make a comment on that.
Rachel, can you?
Rachel.
Yeah. So for polio, by and large, it is the nurses and practices who already administer polio vaccines who are doing it, together with the school vaccinators who are offering some additional clinics. Not actually totally sure how it's working in Hornsey. I expect they've used some of the people who are the COVID vaccinators, but the majority of this is essentially additional capacity from practice nurses. And just to say that a bit of additional funding has been made available to practices for workforce. So essentially, if nurses are doing additional polio clinics, then that is being funded by the ICB, and a small amount of funding has been made available for to support outreach and call and recall. Again, it's much less than through COVID, but it's smaller scale. And likewise for the COVID vaccine, we're using primarily the same centres that we've been using. So they're going back to their vaccinator workforce who they called on through COVID, but it's smaller scale. So we're not the kind of call on staff is much lower.
Thank you. Anecdotally, I note that some practices have been asking for volunteers, but more the sort of marshals, that side of things, supporting around that. I've seen that locally happening, which is really good, and hopefully we'll have lots of residents going forward. I was also going to suggest that maybe at a future session where we might talk about some of the work that Damani and the team have done around outreach, and just broader vaccination and immunisation, because we know that's a challenge, and I know that would probably be of an interest at the session. So we can think about when that might be appropriate to bring that, but it would be good to highlight that as well. And if we don't have any other questions or comments, then I suggest we move on to item 12.
So, Chair, just a quick one. If we have 1 minute, I beg your pardon. I would have put my hands up. It's slightly oblique, but what's the update on monkeypox? Very briefly.
Happy to give a brief update. So, as you'll be aware, there's been an outbreak of monkeypox across the world, global outbreak. We've not seen outbreaks outside of countries where it's previously been endemic, mainly in West Africa. So it's particular concern, particular risk groups are gay, bisexual, and other men who have sex with men. And in fact, the overwhelming majority of cases are in this group. So really important that we work with that community to protect that community. This strain of monkeypox doesn't seem to cause severe illness in terms of people requiring intensive care or die, unfortunately, but it does cause very painful lesions and symptoms, and it is very concerning for people who have contracted monkeypox. How we're tackling this, so originally the focus was on finding cases, contact tracing, preventing transmission. Now the focus is very much moved to vaccination, and vaccinating people who are at high risk of monkeypox to protect them and prevent outbreaks. We're now seeing the number of cases starting to plateau, and we did see some data that's starting to come down, but we're not sure of the long-term trend. Vaccine supplies have been an issue, but are now being resolved. And in London, actually, London is where most of the vaccine supply has been, and we have seen people coming from other parts of the country to access vaccination in London. The main focus of engagement is through our sexual health services. We work really closely with the communities affected and know them best. but we've done other engagement, for example, through Haringey Pride and through Embrace, which is a voluntary and community sector organisation we commission. But it's really good that you brought that up, Jeffrey, and I'm happy to bring an update to a later Health and Wellbeing Board as well.
Thanks. Really good. Thank you very much. Okay, it's good to have that last minute question in there, Jeffrey. Thanks. So I'm going to move us on to item 11, and we've got item 12 even. We've got Christina here for an update on our work to tackle racism and inequalities. Christina, over to you.
Thank you, Councillor Dasnevs. So I'm going to give a kind of highlight update across the partnership programme plan addressing racism and racial discrimination. I think we had a fuller update at the last board and at the community safety partnership joint with this board. So a kind of early bit of work that I thought it would be worth flagging, which sits alongside some of our other community networks which have already been established, like the Somali network, the Turkish and Kurdish community network. Is some work that we've been doing specifically on mental health with local Black males, kind of identified as a cohort who often don't speak about their mental health, and has felt that there are quite a range of issues in terms of engagement with services and kind of treatment within services. So we had a listening session with around 15 men that attended. And that was quite an open discussion that was based around just access to health in general. And if anyone wanted to share about mental health in particular, we're encouraged to do so. We captured notes from that group and have created a bit of a thematic framework with some early suggested actions that we still need to go back to the group with. But as I said, I thought it was just worth flagging here. So some of the key themes that came out were around lack of trust in services, access to alternative and complementary therapies that are culturally tailored to that specific group or groups. Over medication and sectioning was a really significant theme that came out, and there was a lot of feeling around that part of the discussion, which was really striking and felt indicative of the kind of scale of the problem and number of people who have experience locally. Representation in the NHS workforce was another one of the themes, and also resources for the community to deliver and run interventions themselves in spaces that feel kind of familiar and welcoming. So that framework, I think we're looking at having a follow-up discussion with that group in the next few weeks, kind of dates to be confirmed. And that will go as a discussion point to the next Racial Equity and Health and Care group, which will be on the 21st of October, and that group will have a broader focus on mental health. So we'll hear updates from the Trust, from Lynette and Jeffrey and others that are involved there. So the theme of that next Racial Equity and Health and Care group will be around mental health. And I think, I hope anyway, that first discussion that we had will be a really good starting point for a longer term piece of engagement work, and we can continue to build a relationship with that group of men who came and gave up their time on a kind of I think it was a Thursday evening from 6 to 8 p.m. or something. So hopefully we can harness that relationship and early conversations. The other point that I did forget to mention, which also felt really significant, was just one of kind of trust in the system and change, and people giving time and not seeing results off the back of that. And I think it's something that we're all really aware of when we're engaging with residents, about them being able to see the impact of often opening up about really sensitive issues. And people want to see change off the back of that. So that's something we'll absolutely be bearing in mind as we try to take that work forward. Another point that I just wanted to update on, which I feel I always do, but it's been so positive, is the work that Lynette has been leading with the local police on their mental health and kind of cultural awareness. So the training kicked off a couple of months back. I might invite Lynette to say some words towards the end if you want to come in, but I know from conversations that we've had that those sessions have been received really positively. Officers actually having the space just dedicated to how they're feeling, how they cope with incidents and issues that are cropping up in the day-to-day, yeah, without feeling like they have to kind of explain themselves for that. I think that's really powerful, and those relationships that we're building between both the police and the council and Mind will kind of see us really well into the future. We've also been doing some theory of change work across the different themes in the plan with our colleagues from the policy team. So Jean Taylor and Jim Pomeroy have been leading on that, and those sessions have been really useful. So the community safety and policing one, for example, kind of looking at improving trust and confidence in the police as our overall longer term objective within that theme. And the superintendent that we are working with, Rona Hunt, found the session so useful that she's actually invited Jim from policy to go along and do some work with the police on their kind of prioritization and planning. So again, I think some really positive partnership work to highlight there. And then I just wanted to mention, as you did, Councillor Dasnevs, the welcome and resettlement work we're doing around the different refugee schemes, but also the support that we're providing to people seeking asylum and migrants in the borough more broadly. So as you mentioned, we have the Welcome Advisory Board coming up. We were due to have one on Monday, but that date needed to be shifted because of the bank holiday. And as you mentioned, we'll have a focus on migrant health and looking at some specific work that's been underway to improve migrant access to primary care. And I know there's been some really fantastic work that's been led by Health Watch on that. So grateful to colleagues from Health Watch for the input, and I know we'll be hearing more about that at that next meeting. We have under our kind of broader resettlement structure, a health and wellbeing resettlement subgroup, alongside a number of other subgroups that cover the kind of the finance, so the funding that we draw in from different government departments. And I'm trying to remember the other groups that we have now, a kind of broader resettlement one that looks at engagement and safeguarding specifically as well. But that health and wellbeing resettlement subgroup has been looking particularly at support for young people in schools. So we've had a couple of schools get in touch with us to say that they've received quite significant numbers of young people arriving from Ukraine, and that they've really struggled, I suppose, with facing multiple barriers. Kind of firstly, just the extremely traumatic experiences that they've had at home, and then traveling to a new country, facing a language barrier on top of that. And then struggling to integrate with those multiple layers. So we've been looking at what kind of provision might be available in terms of both mental health support, but also just helping the schools with kind of toolkits for young people to integrate. Doing some work with Kerry May from our public health team on the resilience and kind of anchor approach that she's taken more broadly, and seeing how schools might be able to utilise that. So again, something in its infancy, but I think worth mentioning. And then there are also some conversations going on at NCL level within the ICB about mental health provision and what we might do collectively across boroughs to meet some of the needs. I think it's been recognised that just the waiting lists are really difficult for people, and also being able to access mental health support in their language, so either in Russian or Ukrainian in this instance has been quite tricky for people. And then I just wanted to echo the point that was made by quite a few people earlier around housing, and just the huge impact that has across all of our communities who are more newly arrived in the borough. We're particularly feeling it on the Homes for Ukraine scheme, as more of those sponsorship arrangements are starting to either come to an end or break down prematurely. So I think in terms of the wraparound support work that we've been doing that Will mentioned, that's one of the key themes and issues that just keeps on coming up over and over again. And if we can't get that bit right of having families in settled accommodation, then just so much pressure across the rest of people's lives. But we do have it's probably just worth mentioning again 3 welcome hubs that we've got operating across the borough. So one in Wood Green Library, one at Living Under One Sun in Tottenham, and one at Muswell Hill Methodist Church, which, yeah, they're providing lots of practical support and guidance for people. As Will said, one of the very first things that we work to do with people is get them registered with a GP. So that's kind of top priority. But then lots of other things. And as time goes on, we're able to think a bit more about how people can really start to get integrated into the borough once they've got those basics covered. So things like local leisure activities that we can link them up with, and providing more opportunities for specific community groups to kind of network and get together among themselves. We held a really positive Ukraine Independence Day event at Muswell Hill Methodist Church a few weeks back, and that was really well received by the community, obviously kind of tinged with sadness due to the ongoing situation there, but I think people, yeah, they really appreciated the chance to have that space together. And then the last thing that I wanted to mention was just the next coordinating group that we have coming up. So that's the coordinating group addressing racism and racial discrimination, which drives the work that we're delivering across the plan. That'll be on the 12th of October, and we're going to take a kind of workshop style approach to looking at what's worked well across the plan, both in terms of the content and the aims that we're working towards, but also our ways of working, and think about what we might want to change and prioritise over the next year. And that ties in really closely with the theory of change conversations that we've been having across each of the themes. So we'll come back together to do that collectively on the 12th. And I think that is it from me.
Thanks, Christina. There's quite a lot there, and I was particularly interested in that piece of work that you were describing in the listening session on mental health, and particularly that last point's not lost on me, resources for the community to run services and interventions. And that strikes me that there's lots of models in the council where we've enabled that for all sorts of priorities. So I think there's real potential there, isn't there? And none of the other points that you make from that group are really surprising, and they're really national. They you know, whether or not in national, regional, or even in your local area, those are all issues people are bringing up and raising. But good for us to have a piece of work where we can perhaps travel the journey and make a difference to those. So really, just really support all the work. I don't know if anyone else has got any comments or questions on that area. I think, and it's fair to say, isn't it, Christina, there's a piece of work going on about a London response to migrants and refugees. And of course, some of us London boroughs have a vision or a view about how we could be supported by the Home Office. And I don't know when we'll find out, Christina, whether or not our vision tallies with the Home Office's one. Do you know when we know?
I'm not sure, actually. I think the last thing I read, it felt like a decision was sort of imminent in a few weeks' time, which is so often the line. So I'll double check and see if we do have a firm date. But I think that was where we were at with it.
Yeah. So okay. To paraphrase Zena, we're not that optimistic. Nevertheless, I think that's a paraphrase, isn't it? That I can share. But I think the point is we've got a really good focus, I think, in the borough, and at least are attempting to prioritise things that we think are important. If we come back to values that we've talked a bit about before here. So, thank you then, Christina. I don't think anyone else has got any comments, so I think we've arrived at items of urgent business, which I don't think we have any, and future agenda items. Our next meeting is on the 23rd of November, and now I know we weren't able to have our community health and wellbeing grouping because of the bank holiday, so we're in advance of this meeting. But I have committed to try to talk to all the members of that group, just talk about how we best use it and how we go forward, etc. And seeking sort of thoughts about agenda items as well. Don't know if there's anything imminent that anyone wants to raise that they feel we should be covering in the next few months, particularly. No. Okay. Well, we will go off and do our work, our homework, shall we say. Only leaves for me to say thank you all for your contributions, and I hope to see you all soon. Thanks very much.
Thank
you.
very much.
Very much.
Thank you, Chair.
Yeah, thank you very much.